Hi, my name is Brianna Jefferson, and I'm doing my disease project on gonorrhea. Neisseria gonorrhoeae is a gram-negative bacteria that belongs to the Neisseria genus. In this genus, there are only two bacteria that act as pathogens. Neisseria gonorrhoeae causes the sexually transmitted infection gonorrhea, a reproductive infection that is easily spread. A common nickname for this infection is called the clap because of how easily it is spread. This bacteria can be seen under a microscope in the diplococci shape. There are many ways to contract gonorrhea, with sexual intercourse being the number one way of transmittance. Because it is an infection that is passed through bodily fluids, it is common to be in the penis, vagina, mouth, or anus area. Ejaculation does not have to occur in order for gonorrhea to be passed from one person to another. This is because the penis releases fluids before ejaculation. Gonorrhea is seen commonly among teenagers and young adults, but can be contracted at any age. Another way that it can be passed is through the birth canal from mother to baby. As the baby goes through the birth canal, it is possible that the mother passes the infection to her baby, causing an eye infection that may lead to blindness. Gonorrhea needs mucosal cells in order to infect the host. According to Tortora 2019, the bacteria invades the spaces that separate the columnar epithelial cells. These cells are seen in the oropharyngeal area, the eyes, rectum, urethra, and opening of the cervix. Once the bacteria has invaded these cells, leukocytes begin to move into the infected area, causing the characteristic pus discharge. Men are less likely to get the infection, with a 20 to 35% chance of infection when coming in contact with the infection unprotected. Women who have more mucosal cells have a significantly higher chance of catching gonorrhea, with their chances being 60 to 90% chance of infection after exposure. Once the Neisseria gonorrhoeae bacteria has invaded its host via the mucosal membranes, it then penetrates the epithelial wall using its membrane. Endocytosis then occurs and the bacterial cells begin to multiply. The pathogen then invades the spaces separating columnar epithelial cells, and this is when infection occurs and symptoms begin to appear. Singe 2018 says that pili are needed for adherence and that the OPA proteins in the Neisseria bacteria allow for a stronger hold to the surface of host cells. Pore proteins then protect the phagocytized bacteria by inhibiting phagolysosome fusion. Gonorrhea in men is diagnosed by finding the bacteria in a stained smear of pus from the urethra. The gram-negative diplococci within the phagocytic leukocytes are identified under a microscope. Gram staining of pus isn't as reliable with women, and therefore a culture from the cervix is usually obtained. This culture has to be grown on a special media in an atmosphere enriched in carbon dioxide. The bacteria is very sensitive to adverse environmental influences and survives poorly outside the body, requiring a special transporting media to keep it viable before cultivation. Fortunately, cultivation has the advantage of allowing determination of antibiotic sensitivity. Men with gonorrhea are typically asymptomatic. If the man does present with signs and symptoms of infection, they typically are painful urination for a white, yellow, or green discharge. These symptoms usually appear 1 to 14 days after infection. If the infection goes untreated and complications such as epididymitis occur, men with gonorrhea may also complain of testicular or scrotal pain. Rectal infection could occur as well. Signs of this are discharge, anal itching, soreness, bleeding, or painful bowel movements. However, rectal infection can be asymptomatic as well. Pharyngeal infection causes a sore throat, but it too is typically asymptomatic. If left untreated, gonorrhea can cause other complications that can lead to infertility in men. It can also cause a life-threatening situation called disseminated gonococcal infection, also known as DGI. This is characterized by arthritis, tenosynovitis, and/or dermatitis. Women with gonorrhea are usually asymptomatic. Sometimes the woman does have symptoms, but they are so mild and nonspecific that they are misdiagnosed for a bladder or vaginal infection. Some women that may be seen Some symptoms that may be seen in women are painful urination, increased vaginal discharge, or vaginal bleeding between periods. If not asymptomatic, rectal infection includes discharge, anal itching, soreness, bleeding, or painful bowel movements. The pharyngeal gonorrhea infection can go without presenting symptoms as well, but a sore throat may occur. If gonorrhea is not properly cared for and goes untreated, it can spread from the cervix further into the female reproductive system. If the infection makes it to the uterus or fallopian tubes, it can cause PID, pelvic inflammatory disease. The symptoms may range from quite mild to very severe. Abdominal pain and fever accompany PID. PID can lead to internal abscesses and chronic pelvic pain. PID can also damage the fallopian tubes enough to cause infertility or increase the risk of ectopic pregnancy. Diagnosis of gonorrhea is established by identifying the bacteria in gonorrhea in the genital, rectal, pharyngeal, or ocular secretions. And gonorrhea can be detected by culture, nucleic acid amplification tests, and gram staining. In men, a culture is taken from the discharge of the urethra and stained. Under a microscope, the gram-negative diplococci within the phagocytic leukocytes can be seen. Unfortunately, gram staining of the discharge isn't as reliable with women. Usually, a culture is taken from the cervix and grown on special media. Cultivation of the bacterium requires an atmosphere enriched in carbon dioxide as well as a special transporting media to keep it viable during transportation. The bacteria is very sensitive to adverse environmental influences and survives poorly outside the body. Cultivation has the advantage of allowing determination of antibiotic sensitivity, which helps in identifying which antibiotics to use for treatment. Preventing the spread of gonorrhea would help a lot to decrease the resistant strands that have evolved. Ways to do this include improving sexual education and systematic monitoring. By improving sexual education, people can be better informed of how to protect themselves. Testing for STIs and recognizing the symptoms so that they can realize that they may be infected with something. Encouraging people to wear condoms to protect themselves is a great way to prevent the spread of the infection. When used correctly, condoms reduce the risk greatly of getting an infection. Getting tested regularly is a huge part of combating the spread of gonorrhea. When people know their status, they can be proactive about their health and get help if needed. The only way to guarantee that you do not contract gonorrhea is to abstain from sexual activity completely, also known as abstinence. This means no vaginal, anal, or oral sex. Being in a faithful relationship with someone known to be infection free can also stop the spread of gonorrhea. Drug resistant strands of gonorrhea are appearing more and more. The guidelines for treating the infection constantly change in regards to the multi drug resistant strands. One treatment that is universally recognized to work is a 250 milligram dose of ceftriaxone and 1 gram of azithromycin. It is common for people with gonorrhea to also be infected with a bacteria called chlamydia trachomatis. So unless clinically ruled out, the patient is treated for this infection as well. Treating the sex partners of those infected with gonorrhea helps stop the spread and decrease the risk of reinfection.